For Hodgkin lymphoma, most of the patients can be cured with first-line chemotherapy. In fact, this is the hematological malignancy that we have more possibilities to cure with first-line chemotherapy, but there is a small proportion of patients that do not respond to this first line, or that they eventually achieve a complete remission, but they relapse later on. So for these patients, if the patient goes back into a second complete remission, the autologous stem cell transplant is also the standard of care. But unfortunately, autologous transplantation does not cure 100% of these patients. So I would say that the cure rates are around 50%, and some patients have less possibilities to be cured because they have some adverse prognostic factors at the time of relapse, and some patients have more possibilities to be cured with the autologous stem cell transplant. So nowadays we have a very effective drug, which is a monoclonal antibody that basically specifically destroys, to understand ourselves, the malignant cells of the Hodgkin lymphoma, and this drug that has been used with very good results and low toxicity in the relapse setting is being used nowadays, or it's going to be used nowadays, as consolidation after the autologous stem cell transplant, with the objective to reduce the relapse rate after the autologous transplantation in those patients that have bad risk factors for relapse after the transplant. So this drug is being given as an intravenous infusion, 30 minutes every 3 weeks, up to a maximum of 16 cycles after the autologous transplant. And in this prospective study that was already published 2 years ago, more or less, patients being consolidated or receiving this drug after transplant did better in terms of cure after transplantation than patients that did not receive anything.